Hi there folks, this is Matt Scalise, Doctor of Physical Therapy, McKenzie Spine Rehab Specialist, and Orthopedic Certified Specialist. The purpose of this video is to give you an alternative to flexing the low back during your daily tasks. By repeatedly rounding the low back during your day-to-day activities, you expose the spine to unsafe levels of stress. You increase the likelihood of sustaining a low back injury, and you delay recovery if already in the midst of having low back troubles. So let's demonstrate and then talk about the lifting strategy called the squat. In the squat technique, the hips go back and the knees are bent. I like to use sport analogies to help patients remember these lifting techniques, and the sport analogy for the squat is the shortstop position. So in the shortstop position, the hips are back, chest and head are up. Common mistake that patients often make is that they tend to round their low back and they don't move their hips and keep their back straight enough. So another useful alternative for the squat is when getting down into a seated position. Very often, patients will say that they don't need to squat, or that they know that squatting will bother them or bother their low backs. However, they can't avoid sitting down into a chair. So to utilize a good squat technique for getting down into a chair, it looks like so. Unfortunately, too often, patients' first instinct is to do this. Again, as opposed to this. So some key points to remember with the squat. Make sure you allow your hips and knees to move equally in opposite directions. So hips go back, knees bend forward. Also, it's important to make sure you have a wide base of support. Very often people maintain a narrow base of support as opposed to a wider base of support. Often there's the misconception that with a squat you need to keep your back perpendicular with the floor. And that's not a realistic option when you're going to retrieve an object in front of you. So remember, hips go back, knees bend in this position. Once again, it's Matt Scalise, Doctor of Physical Therapy, speaking on behalf of the Global Exercise Group.